When anyone shows symptoms of COVID-19, the first thing that comes to their mind is RT-PCR, a rapid antigen test. But you can also go for blood tests apart from just RT-PCR or antigen tests. The interim clinical guidelines of the All India Institute of Medical Sciences talks about these blood tests. First, let's talk about the CRP test, a C-reactive protein test that measures the level of C-reactive protein in your blood. CRP is a protein made by your liver. A CRP test may be used to find out or monitor conditions that cause inflammation. The test indicates the infection level in the body. The higher value of CRP level than the normal level indicates the infection is increasing. The test is mandatory for COVID-19 patients with critical conditions who are hospitalized because it is one of the indicators showing the body's reaction to the ongoing treatment. The test is also recommended for home isolation patients, also if they do not show any improvement in their symptoms even after the passing of a week or so. IL6 test. This test provides information about the chest infection and cytokine storm inflammation in the body when the body shows a hyperimmune response. It is hypothesized that IL6 might play a key role in the cytokine storm associated with serious adverse outcomes in patients infected with SARS-CoV-2 pneumonia, and that blockade of IL6 would be a suitable therapeutic target for these patients. The delay in sample collection and early measurement in the lab test leads to errors in the results. Hence, it is important to do this in case of hospitalization in moderate to severe cases. Serum Ferritin test. The ferritin blood test is the test that measures the amount of iron stored in the body. High levels of ferritin can indicate an iron storage disorder such as hemochromatosis, which is a chronic disease process. Low levels of ferritin are indicative of iron deficiency, which causes anemia, which means a reduction in the number of oxygen-carrying red blood cells. The Ddimer Test. This test gives information regarding blood clotting in the body parts and if any anti-clotting medication is to be prescribed. Several different studies have looked to measure D-dimer levels in hospitalized COVID-19 patients to determine whether this biomarker could be useful in predicting patient outcomes. Now comes routine tests like CBC, which is the complete blood count, is a group of tests that evaluate the cells that circulate in the blood, including red blood cells, white blood cells, and platelets. The CBC can evaluate your overall health and detect a variety of diseases, conditions, and infections. Complete blood cell count can aid in the early recognition of COVID-19 in patients. The KFT test, which is the kidney function test, are simple blood and urine tests that can help identify problems with your kidneys. The kidneys filter waste materials from the blood. LFT test, which is the liver function test, also known as a liver panel, are blood tests that measure different enzymes, proteins, and other substances made by the liver. These tests check the overall health of your liver. These are important blood tests that directly dictate the management of COVID-positive patients and empower physicians to take timely decisions regarding the next steps and also to advise hospital admission. With the test taking several days, the delay could be crucial.